Welcome to One-on-One with Walt Lascos. In this brief podcast, you'll learn how to most effectively address senior financial exploitation. Now, here's Walt.
So here you are, in what's supposed to be the golden years of your life. But after working for years and years to make a living and perhaps raising a family, you now find yourself all alone. Your spouse passed on several years ago, and now seems that the years are really showing their impact on your body and with your health as well. Aches and pains are becoming more frequent. A good night's sleep has become a cherished memory. Loneliness grows more common with each passing day, making you wonder more and more, what will tomorrow bring? Well, what you've just heard could be a common and frequent description of life for many older adults in our society. Challenging as it may be, add to that life experience occurrences of elder abuse, elder exploitation. Well, to help us grasp the impact of elder abuse on what is supposed to be the shiny golden years of life for so many Americans, I am joined by Kimmy Moon, Deputy Director at the National Center on Elder Abuse. Kimmy, let's start our conversation by having you tell us what the National Center on Elder Abuse is and what it offers as its services.
Thank you so much for having me, Walt. I truly appreciate this opportunity to raise awareness about elder abuse with your listeners because, unfortunately, older adults are mistreated more often than we think. It's estimated that 1 in 10 older Americans living in the community experiences abuse. And unfortunately, that number skyrockets to 1 in 3 for an older adult living with a dementia like Alzheimer's disease. So the National Center on Elder Abuse, or NCEA, is a federally funded resource center housed within the Department of Family Medicine at the Keck School of Medicine of the University of Southern California. And as a national resource center, we provide the latest information and resources on research, training, policy, and best practices on preventing and responding to elder mistreatment.
Elder abuse comes in many forms, not just financial exploitation. So, Kimmy, what are some of those forms?
You're absolutely right, Walt. Elder abuse comes in many forms, and it can also occur in various settings, like in one's home or in the community, in a public space, or in a long-term care facility like a nursing home. So the Centers for Disease Control and Prevention, or CDC, recognizes 5 major types of elder abuse, which include physical, psychological or emotional, sexual, and financial abuse, along with neglect. I do want to add that we want to keep in mind that multiple forms of elder abuse often co-occur, and this phenomenon is known as polyvictimization. So, for example, studies have shown that neglect and financial exploitation often co-occur, and that psychological abuse, often occurs with physical abuse.
Kimmy, can you tell us what are the most reported forms of elder abuse?
Well, that's a really good question, but also a really difficult question to answer because elder abuse is significantly underdetected and underreported. So I'll go over a few stats. So a study conducted in New York State found that only 1 in 24 cases is reported to law enforcement, adult protective services, or other agencies that could provide safety and support for someone who's experienced abuse. And this underreporting can be caused by a number of factors. First and foremost, social isolation is a known risk factor, as well as a result of elder abuse. So when we're not connected to our communities as we age, it's really difficult for someone to notice, identify, and then report the abuse. When family members, chosen family, or trusted others are the ones causing harm, older adults may be reluctant to reveal mistreatment by those closest to them. Shame or embarrassment also pose barriers to reporting, and this is especially true in cultures that, emphasize privacy and preserving family harmony adding a layer of complexity to reporting abuse and seeking help. They also may fear retaliation, such as threats to being relocated into a nursing home, or fear being placed under guardianship or conservatorship, as it's called in some states. Of course, physical limitations or cognitive impairment can also hinder the ability to reach out for help and report the abuse. There are also systemic barriers like limited access to linguistically and culturally relevant resources that again pose significant challenges for folks to reach out. So considering these myriad of reasons that elder abuse is not reported, it's really difficult to then find out which forms of abuse are really occurring the most. And then when we turn to the research, determining the most reported form of elder abuse can be challenging due to variations in research methodologies, the study population and setting. So for example, was a study looking at a community dwelling population or adults in a nursing home, or even the definitions that researchers used. But in one study, which relied on self-reports of abuse, psychological abuse was the most reported. And then another recent study found that financial abuse was the most reported form of abuse. So our center, we do also operate a helpline as a resource center, which is 855-500-3537. That's 855-500-3537, where we receive requests from older adults, concerned family members or friends, neighbors, professionals, or even strangers who are looking for information and reporting resources for known or suspected abuse. I just want to make it clear that we're not an investigating or reporting agency, but we do connect folks across the country who are looking for resources and information on elder abuse and where to report and get help. So in a study that examined the types of inquiries we received through our own helpline, financial abuse was the most commonly reported form of mistreatment. So I know that was a really long explanation to your question, sorry, Walt, but I think that because we know that elder abuse is so prevalent, often very hidden, underreported, and multiple forms of abuse occur, it's really important for us to know the red flags so that we can keep ourselves and our community safe as we age.
And Kimmy, what are the red flags that we all should be watching out for when it comes to recognizing elder abuse?
Great question, Walt. So it's first crucial to know that signs, these red flags of abuse, can often be really overt, subtle, or hidden. They also may present differently by the individual, the context, the culture, and abuse type. So again, elder abuse signs can manifest differently, but typically includes atypical behaviors and changes. So for example, some emotional or behavioral signs of abuse may include unusual changes in behavior or sleep, increased fear and anxiety, isolation from friends or family, or withdrawal from normal activities. Physical signs of abuse may include dehydration or unusual weight loss, missing daily living aids such as walkers, glasses, medications, unexplained injuries, bruises, cuts or sores, unsanitary living conditions, poor hygiene, or unattended medical needs. Financial signs of elder abuse may include fraudulent signatures on financial documents, unpaid bills, again, unusual or sudden changes in spending patterns, their will, or other financial documents. Additional information on the signs and symptoms of elder abuse is available on our website at ncea.acl.gov.
Finally, where would one report abuse?
So if you have a reasonable suspicion that abuse or neglect has been or is being committed, it's really important to report the abuse as soon as possible. And I just want to make it clear that you do not need any proof of confirmed mistreatment to make a report, because there are trained professionals who will look into the situation. So if you or someone you know is in imminent danger, of course, please call 911 or local law enforcement. If the danger is not imminent, you can report the abuse that's happening in a community setting to the local Adult Protective Services or APS agency. And APS is a social services program authorized by law in every single state and U.S. territory to receive and investigate reports of older or vulnerable adult maltreatment, and to intervene to protect the victims to the extent possible. Any suspected abuse in a long-term care facility, such as a nursing home or assisted living centers and board and care facilities, should be reported to the state licensing agency. And in some states, reports of abuse in facilities can be made to Adult Protective Services or APS. So it's just important to know which state you live in to find that information out. In addition to the state licensing agencies, the Long-Term Care Ombudsman Program is a great resource for facility residents and their families. The ombudsmen are trained advocates for residents in long-term care, and they work with them to address complaints and advocate for improvements in the long-term care system. Separate from or in addition to a report to these agencies that I listed, you may want to refer the older adult who's experiencing or is at risk of abuse to community-based services and supports. These may include an agency in the Aging Services Network called the Area Agency on Aging, or a AAA, or the local Aging and Disability Resource Center. Domestic violence or sexual assault services or other victim advocacy programs also exist in communities to offer help. So I know there are quite a bit of agencies that I mentioned, so we do encourage you to contact our partners at the Elder Care Locator to find local services or reporting numbers. They have specialists who are available Monday through Friday from 8 a.m. to 9 p.m. Eastern. You can call them, text them at 1-800-677-1116. That's 1-800-677-1116. Start an online chat with them or even email them at eldercarelocator@n4a.org. And you can also, of course, visit their website at any time at eldercarelocator.acl.gov.
And Kimmy, if someone is looking for more information about the National Center on Elder Abuse, where can they find it?
Thanks, Walt. To learn more about the NCEA and connect to our resources, you can visit us at ncea.acl.gov. You can also send us an email at ncea-info@acl.hhs.gov or call us at our helpline at 855-500-3537. We're also active on social media, on Facebook, Instagram, X, and LinkedIn. So feel free to connect with us so that you can stay up to date on the latest news and resources related to elder abuse prevention, because by being connected with us and our resources, you can learn more about protecting yourself or your loved ones from elder abuse.
Thank you, Kimmy, for taking the time with us today to open our minds to have a better understanding of elder exploitation and the work of the National Center on Elder Abuse. Thanks again for joining us.
Thank you. Thanks for the opportunity.
And thank you all for listening. Stay safe.
If you've enjoyed this conversation, don't forget to follow One-on-One with Walt Laskos wherever you get your podcasts. Feel free to send comments to walt@laskoscommunications.com. And to learn more about how you might support the prevention of elder financial scams, visit laskoscommunications.com.